Hi, my name is Dr. Ross Hauser. Thank you for watching this video. I'm here with my associate, one of the Prolotherapists at Caring Medical, Danielle Matias. So we have a very, very interesting case that we both were involved with. It was one of our great long-term patients had, and I might even call this, and you know this is true as it relates to her, is I would call it hysterical itching. Like it was really, really affecting her. Like, you know, twin daughters, and you know, a lot of stuff to do. And any mother who's taking care of kids, man, you cannot have like itching down this arm and itching down this arm. And so I didn't tell you this, but actually her husband had come in and then he was telling me about it and he didn't know that it related to the neck. Like he had no idea. And then I said, no, you got to have her come in. So why don't you explain, like when she came in, like what did you guys find? And then how has her response been?
So when she came in, she was miserable, like really to say the least. Like she's not sleeping. She's tried so many things to get rid of the itching. She thought it was from too much sun. You know, she had tried staying out of the sun, wearing like UPF clothing. Like she had literally made it to like her wit's end. And we know that itching in bilateral upper arms, there is a condition called brachial pruritus, or brachioradial pruritus rather, that actually can be related to the cervical nerve roots. So the nerves, you know, that come off of your spinal cord in your neck. And so what we did was we ordered a digital motion x-ray, which we have pictures from here. And a digital motion x-ray is an x-ray movie that actually allows us to see if there's instability due to ligament laxity in the neck. So if we look behind us here, this is her neck with her leaning forward and then her extending, looking up at the ceiling. And you can see these nice red lines that are here are, you know, pretty like continuous until we get to here, or they're pretty continuous and they kind of like stair step that way. And those are all, you know, diagnostic for ligament laxity or instability in the neck at nerve roots that go down your arm.
Yeah, a lot of people think about, well, they got a pinched nerve. They don't realize pinched nerves can actually cause itching.
Yeah, absolutely, like a neuropathic itch.
Yeah, so anybody who has, like, you know, somebody has sciatica, they don't realize, yeah, sciatica causes pain in the leg, but sciatica, the same kind of injury to a nerve can actually give you itching in one leg.
Absolutely. And two, on the digital motion x-ray, we did a view looking to see if she did have any narrowing of the neural foramina, which is where our nerves come out of. So if we see these kind of holes here, that's where our nerves come out of. And if you look, like in these two, you see how this one is starting to get more narrow and this one is starting to get more narrow. And you can see the same thing over here, where again, as she's moving, her bones are moving too much and they're encroaching and starting to pinch on that nerve, causing the itching.
And you've heard me say a lot of times, Danielle, that if somebody just follows the neurology, so if anybody who has chronic itching in an extremity or both extremity, just think about, like, you could actually go on Google and see exactly where you have the itching and what nerve.
Absolutely.
Like obviously in this person, that's the C3 nerve, C4 nerve, this is C5, C6.
Yeah.
So, you know, so she probably had in the C5, C6 nerve root distribution, then she has itching. And on her, it was bilateral. And then I see here, see how you can see the space between the two vertebrae there. So that's a sign that there's joint, you know, there's joint instability there. And then how did she do?
She's doing really well. We're actually going to hear from her too, in her own words, how she's doing. But she, even after the first treatment, was able to sleep through the night, which is incredible. Everyone knows you're going to just feel better too when you're sleeping. And after the second treatment, she had almost no itching. And she was not avoiding the sun at that time. You know, she thought that was the first trigger, but she was back out in the sun, swimming with her kids and doing outdoor activities that she loves to do without itching.
Awesome.
Shannon, can you tell me a little bit about your symptoms that you were suffering from before you came here?
Sure. I have been having some severe itching in my forearms and for at least a month and a half, and then it had progressed to my upper arms and was severely having nerve ending pain, burning, but if you scratch your skin, then it makes it severely worse. So I had researched a lot and found that I thought it might be what they call brachioradial pruritus, which is just like an itching, but it's caused by research, I found out by nerves, possibly coming from your neck. However, I didn't really have any symptoms from my neck. I like to work out, so I didn't feel like I was doing anything to irritate, or if I was, I would think I would know. But I had come to Dr. Hauser's office in Chicago many years ago, and I've come here many times here in Fort Myers. And for my wrist, my back, my hip, I've done many things, especially my back, and I've had such wonderful, wonderful results with everything has helped me. And so I went to a neurologist. They told me, okay, let's check out your neck. Let's do an EMG. Everything was a slight bulge. Oh, just increase medication to try to help you sleep at night, because it was severely worse at night. I'd have to put ice packs on. The only thing that brought me relief, from the itching, was ice packs. Because if you touched it, even if when I came here, as you know, you touched me and I would just cry because it was severe. It would make it so much worse. So I put ice packs on it, and the doctor just said, sorry, just check up in 6 months. I'm like, that's not helping me. I have 2 6-year-olds to raise. I have to function. And so I came, and Dr. Hauser couldn't see me, but he said, you can see Danielle, and she's amazing, and she is my lifesaver.
Thank you.
No, seriously, my life is completely changed. I now this will be my 3rd treatment today, and I don't even know that I need it, but I'm going to have it because I'm pain-free. I have no more itching. I thought it was actually due to the sun also, because I'd had this prior, a couple years ago, had a bunch of itching, and they said, well, it might be due to the sun, a dermatologist. And I stayed out of the sun, and it only got worse. So I thought, this can't be happening. This can't be from the sun. I've not been on the sun in 2 months, and it just got worse and worse and worse, and especially in my arm. And Daniel said, let's do a motion x-ray, and let's check your neck.
And do you remember what it showed?
Yeah, it was totally higher up, like C4, where I had a lot of lateral motion, and so the laxity in that was causing probably a pinched nerve of some sort.
Absolutely. And we actually saw on your DMX that when you moved in certain positions, the space where that nerve root would come out actually narrowed. And closed. And so you had positive, significant DMX findings. And so we've treated you twice now with Prolotherapy. Tell me how you're doing today.
Oh, amazing. After the first treatment, I had maybe 2 bouts between that. Only 2 came out within like 2 weeks, and it wasn't anything as severe as I had had. Since the last treatment, I've had 0 symptoms, nothing.
That's incredible.
No itching. I can sleep every night. I've not taken one thing for pain. I've not had to even think about it. I'm like, oh my gosh, this is what life is like again. I mean, I literally told my husband if I had to continue that type of, if I were still feeling that way, I mean, I literally could not be functioning, trying to homeschool my children and to live life. I mean, you can't. If you can't sleep and you can't live with an ice pack on your arm. I mean, like, it was just debilitating. And now I'm back to me. I mean, like, I can do everything I could do, and I'm symptom free. I mean,
That's awesome.
I mean, it's amazing. Prolo it's amazing. It can cure so many things that you never would believe.
That's incredible. And so what we've been doing is Prolotherapy injections into the ligaments of Shannon's neck to work on tightening them and getting more stability in the neck, which then gets that pressure off that nerve root.
And it's been a month since I had my last treatment, and I've had none.
That's incredible.
Nothing.
Oh, I'm so happy.
It's amazing. Amazing.
Thank you for...
Thank you.
Oh, no problem. Thank you for sharing your time with us.